Thank you, Hanya, for the nice introduction. So I would like to add one word to this title. What's the role in CoMiSS in trying to prevent over and underdiagnosis? Because that's what it's all about, and we certainly do not claim that CoMiSS is the final answer to avoid over and underdiagnosis. So you heard in the nice talk of Karina that the prevalence of cow's milk allergy is still a challenge to know how many infants indeed do suffer cow's milk allergy. If you look in general in literature, it's somehow between 0.5 to 3%, depending on the definitions used. And if you look at the Europreval study, which is challenge-proven cow's milk allergy, in Europe it was 0.6%, but as pointed out, that needs an oral food challenge, which means in daily practice a lot of parents refuse that oral food challenge. And these children are considered then as non-allergic. While if you do not apply a food challenge, of course, you risk to overdiagnose. But as also said already, most children outgrow their allergy to milk in early childhood, especially in the non-IgE mediated allergy. So again, from another paper, if you look worldwide, what is reported, oral food challenge confirmed cow's milk allergy 0.3 according to Karina's data, 0.6 according to Europreval. If you look at other papers, it's between 1.9 and 4.9%, and there are even figures that you can find in literature, and I'm not saying that that is the truth, but pointing out that in some developed countries, even prevalences of 10% are reported. It's just about criteria for definition, what you considered as cow's milk allergy, and so it's everything between 0.3 and 10%, what you find in literature. As Karina said also already, you have IgE and non-IgE mediated allergy with all these symptoms, and this is just another way to present those symptoms. If you look at the prevalence of organ symptoms in children with cow's milk allergy, digestive, it's around 60%, respiratory tract 30%, skin manifestations about 70%, general manifestations such as crying and distress, 50% of all the infants. That means together 210%, which means that the vast majority of the infants present with a combination of different organ systems. And non-IgE mediated allergy, according to the paper referred here to, only less than 1% of the infants with non-IgE mediated cow's milk allergy present with one single symptom. So it's a question of combination of symptoms. Diagnosis of IgE-mediated allergy, you also already heard that. That's relatively simple because of the clear time interval, and you have specific rust and skin prick tests to make you more easily feeling confirmation that this child may have cow's milk allergy, although also in these cases you still need the oral food challenge to make the final diagnosis. The real challenge is in non-IgE mediated allergy, where again, according to the Europreval study, around 25% of the infants had non-IgE mediated allergy, and that's probably an underestimation because in the Europreval study in some of the countries the prevalence of non-IgE mediated allergy was 0%, which is very likely to be an underestimation of the reality. But so there is no laboratory test that helps you to think about cow's milk allergy like in IgE-mediated allergy. In order to increase awareness about the possibility of that diagnosis, there are questionnaires available online which are often used by parents because parents are going online. They use Dr. Google and try to come up with themselves a diagnosis. The problem with that is that they are available, but they are not validated, and they are therefore also not really evidence-based. So with that in mind, with this group of co-authors that you saw at the introduction on the photo, we developed the CoMiSS scores, which is the cow's milk symptom-related symptom score. So it's positioned as an awareness tool to help healthcare professionals to think about the possibility of cow's milk allergy before that child that presents with a mixture of different mild to moderate symptoms. And up to now, there are not 25, but 26 studies, original randomized controlled trials, which have used CoMiSS. So what are the symptoms that are scored? It's gastrointestinal tract in general, so regurgitation and crying, and according to the severity, there is a score from 0 to 6. Stools are also scored with, and we original CoMiSS score, the Bristol stool scale was used, but then later the Brussels infant and toddler stool scale was developed because, of course, stools of non-toilet trained children which wear diapers look totally different than the images of the Bristol stool scale, and so what we could do is switch from Bristol stool scale to the BITS without changing the outcome of CoMiSS, and so also the stool consistency gets a scoring. And then you have the skin manifestations, including atopic eczema with, I would call it, a simplified scored score, and then also urticaria and angioedema will get a scoring. And finally, respiratory symptoms are also included. It has been a lot of debate to include them or not, because we are, of course, especially talking about infants, and whenever infants do have respiratory symptoms, it's of course most of the time related to infections. And we see for each of those symptoms that they have to persist for a certain period of time, and that there has been no arguments for infectious disease, so no fever, etc. So that ends up with a score going from 0 to 33 as a maximum score, and the interpretation of the total score is then that a total score of less than 6 makes, according to the available literature and evidence, that the symptoms are not likely to be related to cow's milk allergy, while a score of 10 and more may be suggestive of cow's milk-related symptoms and could potentially be cow's milk allergy. So the CoMiSS scoring form is not intended to be used as a diagnostic tool and should certainly not replace the oral food challenge. So cow's milk allergy diagnosis should be confirmed by a 2 to 4 weeks elimination diet, followed by that oral food challenge. As Anya said, we just published within ESGAN a new position paper about diagnosis, management, and prevention of cow's milk allergy. And we say there as one of the statements that the baseline CoMiSS-related symptom score and its reduction during an elimination diet may be indicative for cow's milk allergy, but is not diagnostic. And then the question is, of course, by increasing awareness, do you favor overdiagnosis, yes or not, that's open for debate. So by increasing awareness, it may favor overdiagnosis, but on the other side, in order to have a score of 10 or more, you need maximal symptoms in at least 2 organ systems. And which means that an infant which only cries a lot, or only has constipation, or only has diarrhea, or is not considered as having cow's milk allergy, because your score will be maximum 6, which is then not suggesting cow's milk allergy. So it avoids that all those children presenting with one single manifestation are considered as possibly having cow's milk allergy and put on elimination diet. So in that way, depending on healthcare professional, it may also decrease the diagnosis, because in Belgium every crying baby is put by healthcare practitioners on extensive hydrolysates, which is certainly something to be avoided. And as this slide shows you, from data from the UK, by increasing the awareness, the black line, you increase the prescription rate of hydrolysates. But at the same time, the dotted lines, you decrease the prescription of medication, which most of the time is also not useful, is useless, and has adverse effect. So increasing awareness means indeed increased prescription rate of hydrolysate, but at the same time in combination with a decrease of inappropriate prescription of medication. These data from China nicely illustrate that by putting children on a diagnostic elimination diet, you decrease the CoMiSS score both for eczema and urticaria, the respiratory score, and the CoMiSS score overall shows you a nice significant decrease in those children, especially with cow's milk allergy. So CoMiSS cannot be considered as a standalone cow's milk allergy diagnostic tool, but that is useful as an awareness tool for cow's milk allergy as well as for monitoring symptom improvement. And a decrease of CoMiSS score during that cow's milk elimination diet is predictive of seeing an reaction to the oral food challenge. So as I said, we recently updated the CoMiSS tool. Initially, just by consensus, the cutoff was put at 12 or more, but then as more and more studies were performed and the literature was reanalyzed, we changed the cutoff from 12 or more to 10 or more, and a lower score was according to the available evidence from the 25 trials, not indicating to be cow's milk allergy related. So the diagnosis of cow's milk allergy remains elimination diet for 1 to 4 weeks, followed by reintroduction in breastfeeding and challenge in formula feeding as a must to confirm the diagnosis. So again, from our consensus paper or our position paper, in clinical practice, the open oral food challenge is clinically more feasible and practical than the double-blind placebo-controlled food challenge and is sufficient to confirm the diagnosis of cow's milk allergy and the development of oral tolerance. And in IgE-mediated cow's milk allergy, the oral food challenge should be supervised by trained medical healthcare professionals. So the diagnosis remains oral food challenge. Summary, cow's milk allergy is a complex disease, difficult to diagnose. Its reported prevalence ranges somewhere between 0.5 and 3%. Most of the children outgrow milk allergy in early childhood, certainly the non-IgE mediated allergy In the Europreval study, all the children with non-IG mediated allergy were tolerant to cow's milk at the age of 1 year. IG is usually rapid in onset and relatively easy to diagnose with tools available to support the diagnosis, while non-IG mediated allergy can be delayed and dose-dependent and is difficult to diagnose with lack of supportive tools. So consequently, awareness of the symptoms is not always known, with cow's milk allergy being misdiagnosed both over and under, having consequences for children, as Karina just showed you. So the CoMiSS tool was designed to support the diagnosis of the probability of cow's milk allergy and to raise awareness among healthcare professionals. It was a recent update, and it's a simple, easy, fast, non-invasive awareness tool. It takes 2-3 minutes to fill it in, and it's used to support the diagnosis of cow's milk allergy. But again, it is not a diagnostic tool, but it can be an effective tool to support the healthcare professional in avoiding under or over-diagnosis of cow's milk allergy. Thank you for your attention.
Thank you, Yvan, very much. Thank you.